Hello, everyone. We have an interesting case today with a straightforward question. A 54-year-old man who was referred by his primary care doctor for assessment of nephrotic syndrome because he recently found to have some leg edema and weight gain with a creatinine of 1.1, 24-hour urine protein of 6.6 grams, positive antiphospholipase A2 antibody, and kidney biopsy was performed that showed membranous nephropathy with positive antiphospholipase A2 receptor antibody staining. And the question is, all of the following is correct regarding the course and the treatment of this condition except. So we need to find the wrong answer. Okay, A, the course in adults is variable, but about 30 to 40% of cases develop progressive disease. B, 30% of patients undergo spontaneous remission, especially in younger females. C, cancer screening for secondary membranous nephropathy is similar to the age-appropriate cancer screening investigations for general population. D, steroids alone in adults are typically ineffective and a combination therapy is usually needed to control the disease severity. E, Botticelli regimen of alternating cyclophosphamide and glucocorticoid is inferior to newer regimens for primary membranous nephropathy. Which one of these statements is wrong? And the correct answer is the Botticelli regimen is inferior to the newer agent because this was not proved in the most recent randomized control study. Actually, alternating cyclophosphamide and glucocorticoid in the Botticelli regimen was effective compared to the B-cell depleting agent like rituximab, and I'll show you the evidence. So the first choice was not bad because the course of adult cases of primary MN is variable, but about 30 to 40% of cases develop progressive disease. So this is correct. 30% undergo spontaneous remission. As you know, this is the reason that we usually wait 3 to 6 months in patients with mild or moderate disease, not in high-risk patient. High-risk patient, we don't have to wait. But if there is no high risk, or if the serum creatinine is not going up, the kidney function is stable, proteinuria is not aggressively going up, antiphospholipase A2 antibody is not going up, so we can wait 3 to 6 months for the 30% chance of spontaneous remission. We usually do a cancer screening recommendation similar to the age-appropriate cancer screen for general population. So for men, we look for prostate cancer. For women, we look for breast cancer and the other colon and lung cancer screen. Corticosteroid monotherapy has been shown to be ineffective, so membranous nephropathy has to be treated in combination with steroid with either cyclophosphamide, cyclosporin, calcium inhibitor, or rituximab. So monotherapy of glucocorticoid is ineffective. There is two main trials I want you to focus on. One is the Mentor trial, and the Mentor trial, they compared rituximab versus cyclosporin to prove non-inferiority of rituximab in primary membranous nephropathy. And what they found was not only rituximab is effective at 12 months, but was superior to cyclosporin at 24 months. So this trial lends a strong support for the use of rituximab as first-line front therapy for primary membranous nephropathy. While a Sterman study that was published in 2021, they compared tacrolimus plus rituximab to the traditional Botticelli regimen with alternating cyclophosphamide and glucocorticoid. We know months of IV cyclophosphamide, 3 days of IV 3 days of IV steroids, and alternating with another 3 months of cyclophosphamide. They compared this Botticelli regimen with combination of tacro plus rituximab. And what they found was there was uh, no superiority of rituximab plus tacro compared to Botticelli regimen. The traditional one was alternating cyclophosphamide and glucocorticoid. More importantly, they found that there was more remission in patients who were treated with traditional Botticelli regimen with cyclophosphamide and glucocorticoid, and more complete remission in this alternating steroid and cyclophosphamide group. So still traditional Botticelli regimen can be used and of favor according to the Sterman study. And here is the reference for the Sterman study that was published in Kidney International in 2021. And of course, we know the mentor trial that was published also several years ago by the Mayo Clinic group. Thank you so much and have a good rest of your day.